We talk a lot about self-care and healthcare, so we can save energy, maintain inner balance, and stay as healthy as possible. But the question is, how do we care for ourselves while we care for our patients? It turns out the heart holds a key to self-care, and it can help us and our patients as well when we all know how to tap into it. Going through a health crisis can be scary and lonely, and patients can experience waves of stress and fear. These emotions can affect their nervous system, and the resulting chaotic heart rhythm patterns can burn a lot of energy and compromise their overall capacity to heal. Being around that chaos day in and day out can affect us as caregivers as well. So it's important to find and utilize simple tools that can care for ourselves as well as our patients in ways that help us all thrive physically, mentally, and emotionally. Everyone who has a job has to-dos, checklists we have to get done. As healthcare providers, we are in the unique position that our to-dos impact other human beings in a very vulnerable moment in their life. When we are stressed by our to-do list or angry or frustrated, our heart rhythm patterns become chaotic, and that broadcasts an electromagnetic field that can impact our patients, their families, and our fellow caregivers. When we can learn how to transform these feelings into compassion and kindness for both ourselves and the people in our care, then we are broadcasting a harmonious signal into this field environment, and that improves our personal resilience and well-being as well. Science shows us that when we balance our heart rhythm patterns, which we measure through heart rate variability, not EKG in this case, it can have a beneficial effect on us as well as our interactions with our patients. Choosing to radiate love and kindness can transform this energetic field environment into a healing environment, and other people can palpably feel the outer impact of our inner choices, our patients, our colleagues, children, and even our pets. The two tools you are about to learn can help you feel better yourself and also enhance what we are feeding the field. When we walk into a patient's room, or approach a distressed family member, or hold a newborn, or interact with our coworkers, you can share this simple tool with anyone who is experiencing stress, pain, or trauma, or just needs a little help. Heart-focused breathing and the quick coherence technique can help those in need find more balance and calm. And as we share this with others, it can help us connect to the heart of what they may need for their wholeness and healing. So how do we do this tool for ourselves, and how do we share it with others? We can just start with heart-focused breathing. Step 1. Focus your attention in the area around your heart, the chest area. Imagine your breath is flowing in and out of your heart or chest area, breathing a little slower and deeper than usual. Just find a rhythm that's comfortable for you. If this first step, the breath alone, is all you or your patients can do, that is more than fine. It will help create more balance and synchronization in our autonomic nervous system, which facilitates many aspects of healing. But if you can, while you continue to breathe through the area around the heart, infuse this breath with a renewing emotion, such as care or compassion or love, or whatever comes easy to you. This will help create a sustained shift in the heart rhythm patterns. And we call this adding of a renewing emotion the quick coherence technique. So add in this second step, step 2, and make a sincere attempt to experience a regenerative feeling, such as appreciation or care for someone or something in your life, and breathe that feeling through the heart area right now. And as you continue to breathe that feeling through the heart area, just know, really, any renewing emotion will help sustain this shift, such as compassion or courage, or the love you have for someone or a pet, or the pride you have in an accomplishment, or just simply a feeling of calm or ease. Just continue to breathe that through the heart area. You may notice something shift mentally, emotionally, or physically, or you may not notice anything right away. There's no need to look over your shoulder to see if it's working, because the benefits of these 2 steps with a little sincere practice accumulate over time, and there is a carryover effect that can positively impact the next moments of our life. We can learn to do this for ourselves or share it with others and patients, even in the middle of highly stressful environments. You can teach this to a patient when they're scared, or you might do it for yourself during or after a code to recover. It really can change our energy levels throughout the day. Is there anyone you know who could benefit from this tool right now? A patient, a family member, a colleague? Take a moment to consider who needs your care in this way, and simply commit to sharing this with them. One night, at a busy academic medical center, one of our friends, a nurse, found herself caring for a patient who hadn't slept for several days. The nurse gently suggested that the patient put her hand on her heart and guided her to do heart-focused breathing while activating a feeling of appreciation, a quick coherence. The patient fell asleep within moments and slept peacefully for hours. With the nurse's help, that patient found a sense of more inner balance in a very chaotic environment, which in this case helped her sleep. Studies have shown that just 5 minutes of practicing this tool with sincerity increases immune function for more than 6 hours. And people who practice these tools for 6 weeks decreased a stress hormone called cortisol by 23%, while increasing their vitality hormone, DHEA, by 100%. While this could lead to healthier outcomes and potentially faster recovery times for patients, imagine how it can support just your personal resilience. You need to breathe anyway, and you might as well do it with this added heart intelligence. Just remember, with each room we enter, each life we touch, it can be an opportunity to renew ourselves with heartfelt care and compassion or kindness. And it's an opportunity to make a meaningful connection with this other person. And that might help make such a sincere difference in their day. And it could possibly affect their life. This video is a gift for all caregivers worldwide.